The health of cattle on a dairy is an essential part of good husbandry and an animal well-being program. A dairy maintains the health of the cattle by providing appropriate nutrition, housing, and disease prevention and detection, along with well-designed treatment programs. The first step in proper animal health is developing an effective herd health plan in consultation with the herd veterinarian or other knowledgeable professional to minimize common diseases such as mastitis, lameness, metritis, metabolic diseases, displaced abomasums, and infectious diseases like pneumonia and infectious diarrhea. The herd health plan should include a veterinarian client-patient relationship, vaccination protocols, daily observation of cattle of all ages for injury or signs of disease, protocols for newborn calf management, protocols for cattle that develop disease or are injured, protocols for prevention and detection and action for common diseases and parasite and pest control, protocols for non-ambulatory animal management, protocols for euthanasia, protocols to ensure feed safety, and training programs for family members and employees involved in detecting disease and injury and reporting the cases and actions to be taken.
It's working fine, udder is fine, grooming is working fine.
An effective herd health plan emphasizes prevention, rapid diagnosis, and quick decision-making on necessary treatment of sick or injured dairy cattle. While a herd health plan can be verbal, a written herd health plan is preferred for clarity.
Keep following that.
All animals should be permanently identified and an effective record-keeping system employed for animal care and management decision-making. Even with the best prevention programs, animals can become sick or injured. Monitoring and observation are key to identifying health issues early in order to provide effective treatment. Animals should be observed daily to assess the following items: hair coat, behavior changes, which include vocalization, abnormal respiration, feed and water consumption, nasal or ocular discharges, abdominal fill, manure consistency, locomotion, and milk abnormalities.
You see the cow way over there with her red
As
cow.
part of the National Dairy Farm Program, the evaluator will observe animals and score them in 4 areas: hygiene, locomotion, body condition scoring, and hock lesions. Proper sanitation and waste management keep animals dry and clean and free of manure and provide them with comfortable, healthful surroundings. The goals of sanitation for animal facilities are to minimize animal disease through clean facilities, minimize generation of odors and dust, minimize pests and parasites, minimize spread of pathogens. Basic sanitation practices include keeping the interiors, corridors, and storage spaces of animal facilities clean, cleaning waste removal implements frequently, and emptying waste containers. Facilities should be free of standing water, excess manure, unnecessary farm items, and clutter. Sanitation may be achieved by heat, chemicals, or high-pressure washing, or by manually scrubbing equipment and surfaces in the facilities with appropriate detergents and disinfectants. It's recommended that producers clean and disinfect equipment such as bucket loaders, scrapers, and shovels routinely. Feed and bedding should be clean. Personnel dealing with animals should maintain a level of cleanliness to minimize the spread of pathogens. Manure should be removed regularly from facilities and free stalls. At least daily scraping or flushing of traffic areas and walkways improves sanitation and traction. Individual free stalls should be cleaned and groomed daily. Sand or other products provide excellent materials for maintaining sanitation of animals. The National Dairy Farm Program recommends that 90% or more of animals in all pens or groups should score less than 3 on the hygiene scorecard, where 1 is clean and 4 is dirty. An animal scoring a 1 is clean and has no mud or manure on the tail region, belly and udder, or on the thigh and lower rear legs. An animal scoring 4 is dirty and has mud and manure completely covering the tail region, the belly and udder, and the thigh and lower rear legs. The scorecard will be used by evaluators and verifiers to determine the hygiene score of animals in all groups or pens. The National Dairy Farm Program recommends that 90% or more of the herd have a score of 2 or less on the locomotion scorecard, with 1 being a normal gait and 5 where the animal refused to bear weight on 1 leg. The Zinpro locomotion scorecard is used to evaluate the herd for lameness, which will interfere with movement to the milking, feeding, and watering areas, limit the exhibition of estrus, and influence general health. Locomotion scoring is based on the observation of cows standing and walking, with special emphasis on their back posture. Cows scoring 2 or 3 should be examined and hooves should be trimmed to prevent more serious problems. Routine examination and trimming of hooves can help prevent foot problems and infections. Whenever lameness exceeds 3% of a herd, measures should be implemented. These may include antiseptic foot baths, more frequent inspection, and hoof trimming as recommended by the herd health veterinarian. Locomotion scoring on a regular basis is recommended. Where possible, avoid exposing animals to sharp rocks, muddy ground, broken concrete or concrete with exposed rocks, and avoid exposure to wet manure. Improper feeding, improper hoof trimming, and inadequate wearing of the hooves can lead to foot damage and should be corrected. The National Dairy Farm Program recommends that 90% or more of the dairy animals should have a body condition score between 2 and 4, with no more than 5% of the dairy animals below 2, where 1 is thin and 5 is overconditioned. The Elanco Dairy Body Condition Score Chart is used to evaluate the body condition of the animals on the farm. The scoring system uses a 1 to 5 scoring system with quarter-point increments. This system uses a flow chart that directs the scorer to view certain anatomical sites of the pelvic and loin area. Use of the flow chart helps develop consistency and replication in body condition scoring. Achieving growth targets for heifers and monitoring change in body condition during gestation and lactation are very important. Body condition can change rapidly at and after calving and should be used to guide ration changes. Body condition scoring for dairy cattle is an important management tool for optimizing milk production and reproductive efficiency while reducing the incidence of metabolic and other peripartum diseases. The National Dairy Farm Program recommends that 90% of cows score 1 and 99% score 2 or less using the NiceChap Hock Assessment Chart for cattle, where 1 means no swelling and 3 indicates that swelling is evident. The NiceChap chart provides a consistent method of scoring hocks for swelling and hair loss, which can help assess the need to modify stall management. A healthy hock is free from hair loss and swelling. Hock lesions are an important indication of inadequate bedding and lack of animal comfort. Dairy farms with a higher prevalence of hock lesions also tend to have a higher number of lame cows. Skin breakage provides an opportunity for infection to occur, which can lead to swelling, discomfort, and possibly lameness. The incidence of hock lesions is reduced with adequate bedding and proper stall design.